What does a biopsy show when diagnosing GERD? Imagine trying to figure out what's really happening inside your esophagus without opening it up. That's where a biopsy comes in. When doctors suspect you have gastroesophageal reflux disease, or GERD, they often perform a procedure called an upper endoscopy. During this, a thin tube with a camera is inserted into your mouth and down into your esophagus. If they see signs of trouble, they might take tiny tissue samples, called biopsies, to look at under a microscope. So, what exactly does a biopsy reveal in cases of GERD? Well, it shows microscopic changes in the tissue caused by long-term acid exposure. GERD causes inflammation in the lining of the esophagus, which is called esophagitis. When they examine the tissue, they often see signs of irritation and damage to the mucosa, the tissue that lines your esophagus. One common finding is inflammation and reactive changes in the cells, which happen because of the acid irritation. Another sign is called basal cell hyperplasia, which means there are more cells than usual in the bottom layer of the esophageal lining. This indicates ongoing injury from acid. The biopsy may also show elongation of the papillae, which are tiny finger-like projections that extend into the tissue. When these are longer than normal, it points to chronic irritation. Inflammatory cells like eosinophils and neutrophils are often present in the tissue samples. Their presence signals active inflammation. In severe cases, the normal squamous cells that line the esophagus might be damaged, showing erosion or even ulceration. Biopsies are especially important when doctors suspect complications like Barrett's esophagus. This condition occurs when the normal squamous cells are replaced by columnar cells that resemble those in the stomach or intestines. It's a change caused by long-standing GERD and can increase the risk of developing esophageal cancer. In some cases, biopsies are taken from the stomach area near the esophagus, called the gastric cardia. This helps check for inflammation or infection, such as from bacteria called Helicobacter pylori, which can also cause stomach issues. The results from these tissue samples give doctors detailed clues about what's happening at the cellular level. They help confirm whether GERD is the cause of your symptoms and if there are any complications. These findings guide treatment decisions, especially if standard therapies aren't working or if there's suspicion of more serious problems. So, in essence, a biopsy shows the microscopic signs of acid damage, inflammation, and potential changes that could lead to more serious conditions. It's a key part of understanding and managing acid reflux and GERD effectively.